Chronic pelvic pain syndrome. Why so many men are told nothing is wrong. We've run the test. Nothing came back. There's nothing wrong. If you've heard that and you're still in pain, this episode is for you. Chronic pelvic pain in men is one of the most undiagnosed and undertreated conditions in men's health. And the reason it gets missed is so often is generally worth understanding. I'm Steve, founder of Male Health Clinic here in Beeston, Nottingham. Chronic pelvic pain, often diagnosed as chronic pelvic pain syndrome or CPPS, is something I see in clinic regularly, and it's a condition that deserves a much clearer explanation than most men receive. Chronic pelvic pain syndrome is a persistent pain or discomfort in the pelvic region, the area below the belly button and between the hips, that lasts for 3 months or more. In men, it often persists alongside urinary infections, symptoms, pain after ejaculation, discomfort in sitting, or aching in the lower back, groin, or perineum. The reason it gets missed so often is straightforward. Standard investigation tests for infection, structural abnormality, or cancer. In CPPS, those tests typically come back normal because the issue isn't an infection. It's often functional, meaning it relates to how the muscles, nerves, and connective tissue in that area are working. When the tests come back normal and the patient is still in pain, there is a tendency in standard care to conclude that nothing is wrong. But nothing on the test is the same as nothing's wrong. A proper assessment for chronic pelvic pain syndrome goes beyond a urinary test and a prostate check. It involves assessing the pelvic floor, its tone, its coordination and sensitivity. It looks at postural factors, movement patterns and lifestyle contributions along with sitting or stress. It treats the man as the system, not just as the prostate with the symptoms. Many men with CPPS have significant pelvic floor hypertonicity, excessive muscle tension that responds well to rehabilitation combined with other targeted treatments. Treatment for CCPS varies depending on what's actually driving it, but typically involves some combination of pelvic floor rehabilitation, shockwave therapy, where nerve or vascular components are present, and lifestyle modifications. The most important thing is that the treatment is directed at what's actually causing the pain, not the symptom in isolation. Progress can be gradual, but it's progressive. And for men who've been told there's nothing wrong for months or years, that's often a generally significant shift. If this sounds familiar to you, and if you've had the test, you've been told everything's normal, and you're still in pain, please don't accept that's the final word. Subscribe below for more honest men's health content. And if you'd like to talk through your specific situation, we offer a free confidential informal chat at Male Health Clinic, where the link is below in the description.